ready.
Okay. Postpartum depression.
Good internal medicine topic.
Yeah, especially for the VA.
Yes, exactly. Good article in New England Journal, though.
Yep.
So our learning objectives are to distinguish between normal disruptions in fatigue and mood and the abnormal. Know what treatments are safe and effective in breastfeeding women. Know what common diagnosis needs to be ruled out in postpartum depression. And know when referral is necessary.
Okay. We have a case? Just start the case.
Am I supposed to start the case?
Oh, I have the case because it was my case. So we do have
panic.
Oh no.
Okay.
This was women only make up 6% of the veterans right now, but that demographic's changing, and we do have women's health service. But this actually came to me in clinic, and so this lady, she's 28, and she made an appointment with me specifically to ask about having a second child. She is a 1-year-old. She's also going back to school. She's been on sertraline for about 2 years for major depression, which controls her symptoms. She wants to breastfeed this baby and would like to know your thoughts about family planning and postpartum depression. Most specifically, she really wants to not take this sertraline. And so I guess the question are, how do we counsel this lady is kind of the bottom line.
Yeah. Yeah, I mean, I think the interesting thing why it does apply to internal medicine is we don't see people postpartum what we think postpartum, but it can have an onset from 6 to 12 months after birth. And that's when we're seeing them, and their OBs aren't seeing them anymore. So
Yep.
I think it's important to remember that.
And yeah, this lady, she actually scheduled an appointment for this. So it's important.
Yep, it is.
So postpartum depression is fairly common, right? About 6 to 12% of women will experience it. I guess what shocked me was that in a year, 20% of those people still have depression.
Right.
And at 2 years, it's 13%.
Right. So it can start a chronic disease.
Yep.
It's not a episodic type of thing for some.
And I think one of our objectives was distinguish between normal fatigue and mood and abnormal. And I think one of the things the article kind of struggled with a little bit was how do you define it?
Right.
To me, I was like,
Because everybody's tired.
Right. And then like the timing and all this. I'm like, well, to me it doesn't really matter. You want to figure out, is this making an impact? And so how do you guys, postpartum blues versus postpartum depression?
Are they still able to function and take care of the baby?
That's important.
Yeah. Functionality is the big one. And then what I liked in there, they had 2 questions they suggested asking.
The simple screen.
Simple screening questions that had a very nice sensitivity and specificity. And the questions are simply, have you been bothered by feeling down, felt depressed or hopeless? And have you lost interest or pleasure in doing things? And if they answer yes to both, then it's worth diving into the weeds a little bit.
Yeah, and I think the timing is important. I think about 80% of women after they have a child, for the first 2 weeks, because of hormonal shifts and everything, can actually have the symptoms and maybe even answer those questions. But again, that's luckily not when we're seeing them. That's their OB's problem, unless it's your sister or your aunt or somebody that's asking you. So, which happens a lot at Christmas gatherings. So. But if it's lasting longer than 2 weeks, that's when you really got to start being concerned.
Are there some medical things we should consider? These are generally young, healthy people, but I still think there's things to think about.
Sheehan syndrome?
Sheehan syndrome, that's a good one.
Yeah.
Yep, right after labor. All kinds of hormonal things going on then. What else is common in pregnancy, or what is pregnancy almost induced? In
Thyroid disease?
Thyroid diseases, exactly. There's almost an autoimmune type of thyroid related to the carrying a child and everything. What else? One other thing that can cause fatigue.
Oh, I'm cold at night.
I'm cold.
I'm getting short of breath when I walk.
I'm tired.
Where's my iron pills?
Anemia?
Yes, anemia.
I like stepping up the clothes like that. That was good. They're not getting there, step them up. But all women should be checked for thyroid and hematocrit first before you give them a diagnosis. You got to rule those things out.
Yeah. And then some other things, some comorbid things that might be really important to ask about. They're also kind of risk factors, like the home situation are things that we should ask.
There's like situational things that can cause depression, right? Domestic violence, which often the stress of a child can make flare up again. Just a kind of a family dysfunction. If you just think that adding a child is a stress, what else can flare up with that? And I think that our veteran women population have a strong prevalence of post-traumatic stress and depression already, or a layer to already build upon because of the experiences they've had overseas.
And then oftentimes things that run with domestic violence is substance abuse. And so don't forget to ask about those, because those should be sort of parsed out and taken care of.
Right. One other thing that you have to be sensitive to for, again, maybe more so maybe in our veteran women population, because there is a stronger prevalence of mental health issues in the population we care for, you do not want to treat someone that may be bipolar with an antidepressant. That can make that person dangerous for both herself and her child.
Yeah. How do you guys screening for somebody that might have bipolar? Any thoughts on what questions to ask? Because if they're bipolar, they pretty much referral.
Yeah.
Yeah.
Yeah. Do not pass go. Do not collect $100.
Get help. So how can you screen for it?
Manic symptoms.
Yeah.
So,
I like the article just said, have you had more than 4 more continuous days when you had an expansive, irritable mood and
Didn't sleep.
didn't sleep? Because if you just put them on antidepressants, you haven't treated the mania, and you can make the situation worse.
They can get
potentially.
psychotic and cause harm to their child. So
Yep.
do no harm.
And postpartum psychosis.
Yeah.
And actually, this particular person had not quite psychosis, but was really on the borderline, and
Didn't she have thoughts of harming her first child?
she did. Yeah. That's a medical emergency, and it's always you kind of always double check your I's and cross your T's, but you might need to EPC that person.
Yeah.
And that's sometimes a hard thing to do, but a life-saving thing.
Right.
Should we talk about treatment?
Yeah.
So one of this lady's concerns was breastfeeding. So what do you guys think about that? I was like, oh man, I gotta look it up.
yeah.
For sure.
Yeah.
And you still will.
Yep, you still will.
It doesn't
And
happen often enough to stick.
it turns out there's not a lot of randomized double-blinded control studies with infants and pregnant women. I don't quite understand why not. Shockingly.
They keep getting disenrolled.
Yes, I don't know why. Damn that IRB.
Yeah.
But what I learned from the article, which was super helpful that I didn't know before, was most of the SSRIs get into the breast milk at a very low concentration
And non-harmful.
and are not considered harmful. And sertraline, in fact, almost, which is the one that she happened to be on, almost doesn't get into the breast milk at all.
Yeah.
And so if they're, and the thought is if they're on an SSRI that's working well for the depression, the risks of taking them off is not worth it. And they can feel reassured they can breastfeed. And there's some observational data with fluoxetine and mirtazapine.
Yeah.
And I think that definitely no TCAs. And I
I
think,
just think sedating, I think.
yeah, exactly.
Because you wouldn't want sedation to pass into the breast milk, obviously. So if it hasn't been studied, I still would stay away from anything sedating.
Yeah, and so somebody has severe anxiety that normally you'd maybe give them a benzodiazepine for,
Right.
to get them through, I would,
Can't
mental
do it.
health.
Yeah.
Yeah.
Referral.
Referral. And then, so that's kind of severe disease, but what about somebody that's not terribly severe disease? Are there other things we can do to help treat them that are effective?
Counseling.
Love it.
Yeah.
Safe for breastfeeding and pregnancy.
Yeah. Yeah, exactly.
I can say that. I'm sure there's been no trials, but
Yeah.
I think I can be safe saying that. So.
Yeah, so even like they talk in the article about like a peer support group as
Yeah.
like a first line thing, and then you could even step it up to psychology. And if you're here, we have really, really great mental health resources. They got lots of psychologists, and they can do
Yeah.
CBT. I think 12 to 16 weeks.
Yeah,
Although I-
and effective.
yeah. Although I did
Same.
wonder if like you have the baby and then it's like 4 months later, maybe you're just better because you're sleeping,
Could be.
right?
It helps.
It certainly would.
Yeah, yeah.
I think that's it, right?
All right.
Should we ask them? So what would you guys tell this lady in the vignette?
If she had postpartum psychosis, I would say no.
I asked her to see mental health first.
But you're right, don't go off your sertraline.
Yeah, I
You
said
know.
you really can't go off of it. She said I'm
And
going
you have
off
a
of it
child already.
when I'm pregnant, even though it's a category C. Although I think that
It's
nomenclature
pretty
is
safe in
changing.
pregnancy too.
I said that's fine, but you have to go on it immediately after, and it's probably okay for breast milk. I think it's safe. And I asked her to see mental health and have a structured plan in place. That's what I did. Whether
Yeah.
that's right or not, I don't know. Unfortunately, she did not make her follow-up appointment, and so I don't know how things are. And I have a feeling that maybe she doesn't come because she's not taking the surgery.
That could be. All right, key points. Most women have baby blues that peak in 4 to 5 days postpartum and will resolve within 14 days, so nothing to be concerned about. Postpartum depression can be harmful to both the infant and the mother, so you have 2 patients you're treating, even as an internist. Always check out the hemoglobin and the TSH, which are very commonly abnormal. Cognitive behavioral therapy is a very good treatment for many women. SSRIs are safe, with sertraline having the most data, and refer for bipolar and lack of response to treatment to psychiatry. All right, quick one.
Next year in review.
Year review, that's our
Bring your
commercial.
best articles.